Question for you. Do you take a multivitamin?
When I remember to.
Oh, that's a lot of problems that we have. So according to the National Institutes of Health, Americans spend more than $5 billion on multivitamins every year. But are they worth the money? We need an answer. So who do we bring in? Dr. Matthew Pinto from over in Jersey. How are you?
I'm well. How are you?
So I sent you a picture of all my vitamins.
You did.
Yikes. Am I doing it all wrong?
Well, I don't think you're doing it wrong. What worries me is a lot of the quality of the vitamins you're buying are really poor quality vitamins. So when you buy stuff in these big box stores, pharmacies, the odds are that they don't really have in the actual bottle what it says it has. Or the form isn't absorbable, or there's not the right amount. They're just not high quality. It's sort of like buying a filet mignon at a really nice butcher shop versus going to like a value store and buying a steak.
Got it.
The quality really does matter.
So how do we know what we're looking for?
Well, you know, first of all, the biggest thing is to find out what you need.
Okay.
And there's ways to do that. There are blood tests you can have, very specialized blood tests that will check your levels of all your vitamins, amino acids, minerals, and tell you what you need. So that would be a good first step. But let's just say you don't have access to that or you don't want to do that.
Okay.
Everyone needs a good multivitamin, multimineral. Okay? So I usually tell people if your multivitamin, multimineral is a tiny little gummy bear, or if it looks like Fred Flintstone, or it's a little white circle, it probably does not have all the products that you need in it. So an example of a multivitamin that's a high quality nutraceutical grade multivitamin are these 2 tan pills right here. And I don't know if you can see them on the air, but that's what a basic serving of a multivitamin, multimineral should look like.
This size?
At least that. And that's a 2 a day. They have ones that are 6 a day.
If mine is that one.
So how could that possibly contain all the same things that has?
I gotcha.
It just can't, right?
Okay.
So it's important to look for a quality one. There's nutraceutical grade vitamins. They're verified by third parties. Typically, they're sold online, but you can also get them at places, you know, like chain vitamin shops will have decent stuff, health food stores, you know, those type of things. But I would say big box stores, pharmacies, supermarkets, probably not the best place to buy your vitamins.
So is that why sometimes we always see those like buy one, get one? They're always on sale, I feel like.
You get what you pay for. That's all I will tell you.
Jeez,
yeah.
okay.
Yeah.
What's this one?
So these are fish oil pills, and I think you have some of those.
I do have fish oil.
They probably look similar.
Yeah.
One of the big things so this particular brand, 2 of those gives you the dose of about 4 of the over-the-counter type ones that you would see in most stores.
Oh, okay.
But the biggest thing is, think about it. Fish swim in the ocean. The ocean is polluted for many, you know, there's lots of stuff in the ocean.
Right.
You're eating the oil from those fish.
Okay.
If the fish aren't eating the best stuff, then you're going to get all that nasty stuff inside of you.
Right.
The high-quality fish oil pills are purified, so they take all the pollutants out. And there's stuff so a lot of people that take fish oil will come to me and say, it gave me a stomach ache, or it gave me gas, or I didn't feel well. It's all the pollutants in it. If you freeze your fish oil, if you freeze it and it freezes in the freezer, then it has stuff in it besides the fish oil. Fish oil shouldn't freeze. So
is that a test you should do? Wait, to your little item, your supplement? You can freeze it?
Yep, freeze them and look at them. If they turn hazy or frozen, there's other stuff in them besides the actual chemicals that you want.
You're good at
which are the fatty acids, right?
What's this one?
That's vitamin D, and that's 5,000 units of vitamin D. So unfortunately, a lot of people take vitamin D, but they take 400 units or 1,000 units, and that's not enough. It doesn't get your vitamin D levels up, especially this time of year when you look outside like today.
Seriously.
And there's no sun. You're not making any vitamin D at all.
Okay.
But even in the summer, we wear clothes, we wear sunblock, we're in cars, we're in buildings. We don't get the sun exposure on our skin to make vitamin D. You need to still take extra vitamin D in, and unfortunately, unless you take a higher amount, you're not going to raise your levels. That's a very simple blood test that every primary care doctor should be doing on their patients at least once a year anyway. So everyone should get their vitamin D levels checked once a year.
So if I'm flipping through magazines on the plane with my friends and I see like in your 30s you should take, and it gives you a long list, which is how I ended up with this big pill box, it's not necessarily what I need.
Right, exactly. Okay. I mean, those are giving you general guidelines. You know, the reality of it is that we don't know what you need, and you're not going to hurt yourself most of the time taking normal amounts. You know, things like you had vitamin C, you had zinc, you had lysine. Those are all really good immune system boosters. Right. Lysine helps with like cold sores and canker sores and viral infections. Zinc helps with colds, and vitamin C, of course, helps our immune system. But you know, you may not need all of those all the time, so maybe you just boost those up during cold and flu season to help you out.
So I'm not really doing anything harmful, I'm just wasting a lot of money maybe.
Right, and then again, the quality you're getting, you might not actually even be taking what you think you're taking. That's the big thing.
That's weird. Okay, so I should call you or my PCP. Where can people find you?
So I'm in Marlton. My practice is called Vive Medical Weight Loss and Aesthetics, and we have a website, vivecenter.com. We actually offer a blood test that you can get done. Insurance sometimes covers it, but not always. And that will give you an assessment of every vitamin, amino acid, and mineral in your body, in your cells, which is different than a regular blood test, which looks at serum levels, which is just how much vitamins in your actual blood. This looks at your cellular levels, how much are you actually absorbing. And it's a really interesting test. And it actually can help you determine a lot of different health issues that people are having that they don't realize they're having, because they're not absorbing certain vitamins or minerals.
That makes sense, because I feel like, sometimes on this schedule, waking up early, I'm always tired, and I'm like, is it because of my schedule, or is it because of something else?
You never know.
You never know.
You never know unless you check.
All right. Thank you so much for
You're
stopping
welcome.
by. We
Thank you.
appreciate it.